What's going on, world? Welcome, welcome, welcome. Hey, today, it doesn't matter what today is. We're doing NCLEX questions today, all right? We are doing NCLEX questions, NCLEX questions, NCLEX questions. How y'all doing today? Welcome, welcome, welcome. Hey, we're doing NCLEX questions today, all right? So what I want y'all to do, I want y'all to smash that like button, all right? I need 1,000 likes and I need 100 people in here. So I need for you to like, share, and follow. Diamond, what's up? What's up? Riches, who is it? Riches Barbie, I see you. Veggie inhaler, I don't even know what that means. Does it mean you eat vegetables like really fast without breathing? You might want to be careful. It might be a choking hazard. All right. Hey, so welcome, welcome, welcome. Hey, Nurse Cass is in the building, y'all. Nurse Cass is in the building. She's in the building. All right. Hey, let y'all know Nurse Cass will fight you. All right. Just because, I don't know, she got anger problems. That's why she works in corrections. So you guys already know what we're doing. We are doing NCLEX questions today. NCLEX questions. I got a couple for y'all. So make sure you guys like, share, and follow. Hey, I need 1,000 likes and I need 100 people in here. I need both. If I don't get that, you don't get questions. So it would behoove you, and I don't say that often. I don't say that often, but it would behoove you to share the live, like the live, and get people in here, all right? Hey, if you guys are just now joining or have ever been to any of my lives, my name is Kevin. I go by the Boot Nurse. I've been a nurse for almost 4 years. I've worked ICU, OR, and PACU. I was in the Navy for 16 years. Last 9 of my 16 years, I was a master instructor. So I've taught a whole bunch of other programs. And so I decided to bring my talents into the nursing aspect and to teach everybody about NCLEX. All right. So I want to know who you are, where you're from, and where you're at in your nursing journey. All right. So, hey, I need for you to smash that like button. I need for you to share. I need for you to follow. We need 1,000 likes and we need 100 people up in here. So, hey, the more people in here, the more that you guys engage, then, you know, the more fun, the funner, the funnest. We'll have a good time. We'll have a good time. All right. So, like I said, I just want to know who you are, where you're from, where you're at in your nursing journey. And by the way, if you're not a nurse and you're here hanging out with us, what do you do? What do you do in your profession or in your line of work or non-nursing? Does that make sense? So what's up? What's up? We've got 126 people up in here. Hey, get carpal tunnel for me right now. Make it happen. Get carpal tunnel for me right now. All right. So that way we can get, hey, I'm just saying 1,000 likes. I got all these questions over here. Y'all want them or not? Y'all want them or not? Chelsea says, I'm a social worker. Each time I see your lives, I share them with my friends studying for the nurse. Chelsea, I appreciate you. I'm a nurse, 19 years experience, and also teach NCLEX. Shout out to you, Jennifer. I'm a first-year ADN student. Shout out to you, Secret Crush. You my secret crush? It ain't a secret now because I know. Jana's in the building. What's up, Miss Lady? Hey, if you guys don't know the emo nurse practitioner, she's a homie. A1 since day one. Shout out to you, Jana. All right. Hey, we're almost there. We're almost to 1,000 likes, y'all. Once we get 1,000 likes, then I'm going to turn this thing around and y'all ain't got to look at me. All right. Hey, you guys already know the deal. We are going to do some NCLEX questions. I want to go for nursing, but probably try first for LVN. You can do anything you want in nursing. If you want to go LVN first, cool, do you. Don't let anybody tell you any different because they don't know what your pockets look like. So if you want to go the LVN route, cool. If it's better for you to go the RN route, also cool. All right. Here we go. Question number 1. It says, I love the way you teach. So amazing. Jennifer, I appreciate you. I really do. Here we go. Question number 1. Among the following signs and symptoms, which would most likely be present in a client with mitral regurgitation? Is it altered level of consciousness, exertional dyspnea, increased creatinine phosphokinase concentration, or chest pain? Kevin, I passed my NCLEX. Vicky, first of all, you are number 1 to come up in here and tell me that you passed your NCLEX today here on this Wednesday. Second of all, congratulations to you. Welcome to the greatest shit show on earth known as nursing. Whether you're an RN or an LPN, congratulations to you. If there's a piece of advice that you could give to all 163 people out here, what would that be? What would that be? And once again, ma'am, congratulations to you. I need all of y'all to give her flowers right now. I need all of y'all to congratulate Vicky, Nurse 1, right now. Stop playing games. Stop being greedy. Because if it happens to you, best believe I'm going to tell everybody to do the same thing for you. All right. Here we go. Here we go. I'm going to give you guys another 15 seconds. Another 15 seconds. Shout out to all 200 plus of y'all. We are doing NCLEX questions. By the way, I got I got these. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. It says, never stop bettering yourself in your practice of life or life. I love it. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B. It is exertional dyspnea. Mitral regurgitation is defined as an abnormal reversal of blood flow from the left ventricle to the left atrium. Weight gain due to retention of fluid and worsening heart failure causes exertional dyspnea in clients with mitral regurgitation. The patient will usually complain of significant dyspnea at rest, exacerbated in the supine position, as well as coughing with with clear or pink frothy sputum. That is part of physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. Never second guess yourself. Hey, your first answer, 9 times out of 10, is the correct answer. Now, remember, with mitral regurgitation, it gives off the same types of signs and symptoms for somebody who has congestive heart failure, right? Think about that, right? Dyspnea, but cough with clear or pink frothy sputum. All right. Those are those key things you have to remember about those disease processes. All right. So shout out to y'all for getting this right. If you got it wrong, circle back and get your content. All right. Here we go. Question number 2. Chris, with a history of chronic infection of the urinary system, complains of urinary frequency and burning sensation. To figure out whether the current problem is of renal origin, the nurse should assess whether the client has discomfort or pain in the what specific area. All right. Is it the urinary meatus, pain at the labium, the suprapubic area, or right or left costovertebral angle? What are we thinking? Says, this is great. I'm so happy I found your TikTok. I test in June. Haley, another Haley up in here. Shout out to you, Haley. I'm glad that you were here. Make sure you guys like, you guys share, and you guys follow. Discover Kevin before Block 4. Just now finished up Block 4, ready to I love it. Zay, I love to see it. I love to see it. Hey, we're on the road to 10,000 likes, y'all. We're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, my throat hurts. Just letting y'all know. Play with me if you want to. All right. But here we go. Hey, if you guys are new here, make sure you guys smash that like button. You guys share and you guys follow. All right. You guys share and you guys follow. All right. I'm going to give you guys 15 more seconds. You just learned this. Then what's the answer then? What's the answer then? It says we don't talk about Jane. Well, Jane, I'm talking to you. What'd the answer be? I'm taking my exit exam tomorrow. Shout out to you. Hey, you got it. You got it. All right. Last little hurdle until you graduate. Okay. But here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D, right or left costovertebral angle. All right. Discomfort or pain is a problem that originates in the kidneys. It is felt at the costovertebral angle on the affected side. Flank or costovertebral angle tenderness is most commonly unilateral over the involved kidney, although bilateral discomfort may be present. Discomfort varies from absent to severe. This finding is usually not subtle and may be elicited with mild or moderately firm palpitation. That is also part of physiological adaptation, which is 11 to 17% and the third largest section on the NCLEX exam. It doesn't, LPNs, same thing. All right. You learn the same content that the RNs learn. All right. You just need to know what you can and can't do, what you can and can't accept. It's all about scope of practice. All right. If something's going wrong, guess what? You got to call the RN. All right. RNs, you can't give unstable patients to LPNs. All right. So shout out to everybody that got this question right. As well as shout out to y'all for getting carpal tunnel. All right. Here we go. Question number 3. Nurse Perry is evaluating the renal function of a male client. After documenting urine volume and characteristics, Nurse Perry assesses which sign as the best indicator of renal function. Is it blood pressure, consciousness, distension of the bladder, or the pulse rate? What are we thinking? Hey, if you guys are just now joining, we are doing NCLEX questions. I got them on nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. As well as if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. You know, we don't gatekeep around here. A little bit about myself. I have been a nurse for almost 4 years, registered nurse, BSN, if that really matters to you. And I worked ICU, specifically a burn ICU and a medical ICU. And I worked PACU and I worked in the operating room. So shout out to all y'all for joining tonight. Emma says my first year as an RN student. Shout out to you, Emma. All right, here we go. Here we go. Here's our answer. It says, here's our answer in 3, 2. And the answer is blood pressure. All right. It is the blood pressure. RAS system. Shout out to you, Haley. All right. Perfusion can be best estimated by blood pressure, which is an indirect reflection of the adequacy of cardiac output. Over time, uncontrolled blood pressure can cause arteries around the kidneys to narrow, widen, or harden. These damaged arteries are not able to deliver enough blood to the kidney tissue. Damaged kidney arteries do not filter blood well. Kidneys have small finger-like nephrons that filter the blood. Once again, this is part of physiological adaptation. The third largest section on the NCLEX exam at 11 to 17%. Physiological adaptations cover chronic diseases, chronic issues, acute issues such as trauma, and medical emergencies. These are the big parts, but all of these categories can be intertwined as well, okay? All of these, I could ask you a question that follows that falls under physiological adaptation, but the question is a management of care type of question, like who do you see first? All right. So don't be confused. The more practice questions that you do, the more that you understand it. Okay. So shout out to everybody. Here we go. Here on to the next one. Here we go. Question number 4. John suddenly experiences a seizure, and Nurse Gina notices that John exhibits uncontrollable jerking movements. Nurse Gina documents that John experienced which type of seizure? Is it a tonic seizure, absent seizure, a myoclonic seizure, or a clonic seizure? What are we thinking? Shout out to everybody that is in here. Hey, we're on the road to 10,000 likes, all right? I need everybody in here to get carpal tunnel for me right now. Right now. If I don't have 10,000 likes by the time I get to question 10, I guess all y'all are getting is 10 questions, I guess. So if you guys are new here, make sure you guys smash that like button, you guys share, and you guys follow. I need to brush up on seizures. Brush up on them then. Is it a Tweedledee? Tweedledee? Emma's telling me A. Okay. What else we got? Ashley is telling me C. Okay. What else we got? I'll give you guys another 15 seconds. Deanna is telling me A. Okay. Zay's telling me D. All right. Well, we're kind of all over the place. Took my NCLEX last Thursday and I passed. Monica, shout out to you. Monica, you're number 3 to come in here to tell us that you passed NCLEX. First of all, ma'am, congratulations to you. All right. Everybody in the chat right now, while you guys are answering, I need for y'all to give her all the love. Tell her congratulations. Don't be rude. Don't be greedy. Monica, welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, ma'am, what would it be? What would it be? And once again, congratulations to you. Monica has been to my lives a couple of times, all right? So I remember specific frequent flyers, all right? And I will give everybody the love. As long as y'all come back, hey, you got to pay it forward. You got to pay it forward, all right? All right, here we go. Here's our answer in 3, 2, and the answer is C. It's a myoclonic seizure, all right? And every time I said Monica's name, I said it in my Ja Rule's voice from Fast and the Furious. Oh, here we go. Myoclonic seizure is characterized by sudden uncontrollable jerking movements of a single or multiple muscle group. Myoclonus is defined as rapid, brief, jerky, or shock-like movements involving muscle or groups of muscles. Among all hyperkinetic movement disorders, myoclonus is considered to be the most rapid and brief. When caused by sudden muscle contractions, it is known as a positive myoclonus, while a brief loss of muscular tone results in negative myoclonus, as in hysterexis. All right. Once again, that is part of physiological adaptation. Brooklyn, what's up? Kevin, we need to talk. What we talking about? Yay, send me a DM if you want to talk. But hey, here we go. Physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. For my LPNs, you guys have the same type of categories. The only thing that's different is instead of management of care, it is coordinated care. They essentially mean the same exact thing. All right. So don't get that confused. It says, I will miss TikTok when it's gone. TikTok ain't going nowhere. Stop playing. It ain't going nowhere. it's going to be a long time before TikTok goes anywhere. Probably at least another year and a half if it goes somewhere. So there's a lot of legalities that have to happen once Biden signs it, but we ain't even going to get into that. But here we go. Question number 5. Smoking cessation is a critical strategy for the client with Berger's disease. Nurse Jasmine anticipates that the male client will go home with a prescription for which medication? All right. Which medication are we thinking? Is it a paracetamol, ibuprofen, nitroglycerin, or nicotine? What do we think it is? Shout out to all 180 y'all. We are doing NCLEX questions. If you guys are just now joining, these are both for RNs and LPNs. Make sure you guys like, you guys share, you guys follow. That is the trifecta to get to the For You page. All right. That is the trifecta to get on the For You page. All right. So the more y'all share, the more y'all like, the more y'all follow. TikTok is just like, all right, bet. Let's get people out here before the government shut us down. All right. Farm is my worst enemy. Haley, let me tell you something right now. If farm is your worst enemy, you better know thy enemy, because trust me, those farm questions will be on NCLEX. All right. They will be on there. So if you know thy enemy, and if you know how the enemy moves, and if you know how the enemy works, there's not going to be anything new that the enemy is going to throw at you. All right. Just saying. Here we go. Here's our answer. Here is our answer in 3, 2. I've been reviewing tons. I love to hear it and I love to see it. But the answer is D. It is nicotine. Okay. Nicotine. That's part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. So shout out to everybody that got that one right. Nicotine is given in controlled and decreasing doses for the management of nicotine withdrawal syndrome. Nicotine replacement therapy is for those who want to quit smoking, as abruptly quitting can cause withdrawal and cravings. Nicotine withdrawal occurs after smoking cigarettes discontinued suddenly. Using NRT helps one to reduce the motivation of smoking cigarettes, because the body will get nicotine from another safer alternative. Okay. What's up, D? What's up? What's up? Hey, I think we're meeting tomorrow, right? I think we're meeting tomorrow. So shout out to all 108 y'all that are out here rocking. All right. Appreciate everybody that got that answer. If you don't understand that, make sure you circle back and you get that content. All right. Hey, I'm giving y'all gems right now. I'm giving y'all gems. So I'm going to need for y'all to pick them up. Hey, real quick, I have a free download that you guys can go over there and get on my website. It's called thebootnurse.com/test. Get you some test taking tips to help you conquer the NCLEX. The only thing you won't get with that free download is that delicious melanated man right there and his fanny pack. By the way, get a fanny pack. If you don't got one, get one. Yes, I wear one in public. I don't. I'm just playing. However, when you start dropping shit, working in the hospital, you're going to wish that you had a fanny pack. All right. So my recommendation is that you all go get a fanny pack. But of course, if you're studying for NCLEX, go over there and get you these test taking tips to help you conquer the NCLEX. It's free, FREE. All right. At thebootnurse.com/test. All right. Here we go. Question number. You had one? Beauty. You better keep it. Stop playing games. Get you a fanny pack. All right. And keep that fanny pack. It'll save you tons. Question number 6, Nurse Lily has been assigned to a client with Raynaud's disease. Nurse Lily realizes that the etiology of the disease is unknown because it is characterized by what? Is it episodic vasospastic disorder of the capillaries, of the small veins, of the aorta, or of the small arteries? What are we thinking? I was putting too much in. See, that's just telling me that you have no impulse control. All right. You ain't got to take your whole life in there. Just like some pens and, some markers, some Jolly Ranchers, phone charger, whatever, Thinking Raynaud's can't really mess with capillary. Okay. All right. Okay, Haley. I see your thought process there. Hey, if you guys are new here, welcome. Hey, we hit 10,000 likes. All right. And I appreciate that. Now we got to get to 20,000 likes. All right. So here we go. Carpal tunnel. Make it happen. All right. Hey, if you guys are just now joining, we are doing NCLEX questions. Make sure you guys like, share, and follow. I don't care how you feel about Becky with the good hair. That's at school. You know what I'm saying? Share it to her. All right. She might be cool with me, even though she might not be cool with you. You know what I'm saying? So, because I need all my friends before TikTok goes away. Okay. So here we go. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is D. It's episodic vasospastic disorder of the small arteries. All right. Raynaud's disease is characterized by vasospasms of the small cutaneous arteries that involve fingers and toes. In Raynaud phenomenon, blood flow restriction occurs during cold temperatures and emotional stress. Specifically in Raynaud phenomenon, there is a vasoconstriction of the digital arteries and cutaneous arterioles. That is part of physiological adaptation, which once again is the third largest section on the NCLEX. Deanna, I see you. Third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. Here's something that I want for you guys to realize. It says, okay, well, at least the rationale. So the rationale allows for you to retain the information that you acquired from content and you solidify while answering your question. It helps you to retain the information, whether you got it right or you got it wrong. So it is very important. While getting content is important, your questions and answers are important. You have to review your rationales. I have three things: RTFQ, RTFA, RTFR. Y'all take a guess and you tell me what those mean, okay? It says currently on a downslide, 5 more days left in nursing school. Listening to you has helped a lot. Ashley, I love to hear it. I love to see it. Listen, do not get complacent. Do not get complacent, all right? The last thing I want anybody to do is to stop running their marathon before they cross the finish line, all right? Ashley, I know you're on a downward slide. I don't want you to, you still got one thing left to do, and that's this NCLEX if you haven't taken your exit exam, okay? So everybody, you got to keep it pushing. You got to keep it pushing. Here we go. Question number 17, Nurse Jamie should explain to a male client with diabetes that self-monitoring of blood glucose is preferred to urine glucose testing because of what? So why? Is it because it's more accurate? Is it because it can be done by the client? Is it easy to perform? Or is it not influenced by drugs? What do we think? Hey, if you guys are just now joining, we are doing NCLEX questions. I got these off of nurseslabs.com. Nurseslabs.com. Free sets of questions. You guys can go over there and check them out for yourself. All right. Also, you may hear some people say that these aren't NCLEX style questions. The national board has like over tens of thousands of different types of questions that they could ask you. They very well could ask you a very hard or very easy question depending on how you answer. So there's nothing wrong with getting these questions so you know what to look out for. Shelby's telling me it's definitely A. Okay, Shelbs. I'm over here giving y'all nicknames like I know y'all in person. I mean, I'll probably call you that in person too. So it says, I DM'd you. We need to set up a phone call to talk about a program. Brooklyn, do we? Okay, we'll see what's up. But let's see what our answer is, y'all. Let's see what our answer is in 3, 2, and the answer is A. Because it's more accurate. All right. Urine testing provides an indirect measure that can be influenced by kidney function, while blood glucose testing is a more direct and accurate measure. Accurate measurements of blood glucose is superior to the capillary blood glucose test. However, this is dependent on the laboratory meeting established industry standards. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Hey, Jamie's my name, speaking into existence. I know that's right. Speak it into existence, and it shall be so. Put it out to the universe and let the universe give it back to you, because best believe it will. Whether good or bad. Don't speak negative to yourself. Hey, that negative shit that's out the door. That negative stuff is out the door. Nothing but you have to believe it though. You can't just be like, yeah, I'm going to do well, but then you don't believe it. You see what I'm saying? So just letting y'all know. Here we go. Question number 8. Jamie weighs 210 pounds on admission to the hospital. After 2 days of diuretic therapy, Jamie weighs 205.5 pounds. The nurse could estimate that the amount of fluid Jesse has lost is what? Is it 0.3 liters, 1.5 liters, 2.0 liters, or 3.5 liters? What are we thinking? Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off of nurseslabs.com. Hey, listen, the biggest things that y'all need to do, y'all need to share the live, y'all need to like the live, and y'all need to follow. All right. But of course, participation is a must. What y'all give back to me, I give back to you. All right. And also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're just now joining, my name is Kevin. I am a nurse, a registered nurse with a BSN, if that really matters to you. I've been a nurse for almost 4 years. I worked ICU, OR, and I worked PACU. I was in the Navy for 16 years. And I failed my NCLEX 3 times. Not once, not twice, but 3 times. Shocker, right? So I failed my NCLEX 3 times. And I'm going to tell you right now, nobody cares. Nobody cares how many times you failed this exam. Stop feeling down. Stop beating yourself up. All right? Get out of your own way, because only you will prevent yourself from not passing this exam. Understand why you didn't do well and improve upon it. Failing or not doing well on an exam doesn't determine the type of nurse that you can be. Only you can determine that. That's number one. And you're only a true failure if you quit. Did you pass your exit? I did pass my exit. All right. So shout out to y'all. But the answer is C. It is 2.0 liters. 1 liter of fluid approximately weighs 2.2 pounds. A 4.5 pound weight loss equals to approximately 2 liters. Diuresis is necessary for a variety of non-edematous and edematous conditions, which require clearing out excess water when the body abnormally sequesters fluid in third space in the form of edema. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. So shout out to all of y'all that got that right. If this is an issue for you and you don't understand it, circle back and get this content. All right. Circle back and find the content for yourself. Okay. Here we go. Question number 9. Nurse Donna is aware that the shift of body fluid associated with intravenous administration of albumin occurs in the process of what? Is it osmosis, diffusion, active transport, or filtration? What are we thinking? Eric is saying A. Bree is saying A. Kiki is telling me A. Okay. Emma's telling me A. All right. What else? We got A. We got B. Okay. Rosie is telling me B. All right. Let's see. Hey, if you guys are just now joining, we're doing NCLEX questions. These are both for RNs and LPNs. RNs and LPNs, I got them off of nurseslabs.com. They're free sets of questions. You can go over there and check those out for yourself. It says the good old osmotic protein thingy. Not the protein thingy. All right, here we go. I'll give you 10 more seconds. What are we thinking? Hey, also, I want to know who you are if you're new here and where you're from and where you're at in your nursing journey. All right, here we go. Here's our answer in 3, 2, and the answer is A. It's the osmotic thingy, right? Osmosis is the movement of fluid from an area of lesser solute concentration to an area of greater solute concentration. In physiology, osmosis, which is Greek for push, is the net movement of water across a semi-permeable membrane. Across this membrane, water will tend to move from an area of high concentration to an area of low concentration. It is important to emphasize that ideal osmosis requires only the movement of pure water across the membrane without any movement of solute particles across the semi-permeable membrane. All right. That is physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. I graduate May 16th, just passed my exit. Erica, that's what I'm talking about. Shout out to you. Hey, you're almost there. You're almost there. Mark is watching from the Philippines. Shout out to the Philippines. I have some friends that are from the Philippines. And I was going to say it how they say it. But I realize that I'm on TikTok and I'm not trying to get canceled, but it's all out of love. You know what I'm saying? So you know what I'm about to say. But shout out to you, Mark. Shout out to you, Mark. U.S. Navy, U.S. RN, United States Registered Nurse. Is that what we're talking about? Is that what we're talking about? All right, here we go. Question number 10. Myra, a 52-year-old client with a fractured left tibia, has a long leg cast and she is using crutches to ambulate. Nurse Joy assesses which sign and symptom that indicates complication associated with crutch walking. Is it a left leg discomfort, weak bicep brachii, tricep muscle spasms, or is it a forearm weakness? What are we thinking? Shout out to all 82 souls that are inside of my TikTok live here. Hey, we're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions, both for RNs and LPNs. Make sure you guys go over there and check them out for yourself. Also, I have a free download. You guys can check that out. It's the link tree in my bio, 42 pages. Make sure you guys get over there and get it because it's about to go away, and I'm going to put something else up there new for y'all. So Tosh is telling me B now. Tosh, you change your answer. Hey, you know the deal. You got to be able to really articulate to me 100% why we change answers, all right? Remember, if you didn't read the question, read it all the way through. If you didn't read the answers, read it all the way through, all right? Here we go. Here's our answer. Here is our answer. All right, D, we finna find out in 3, 2, and the answer is D, the forearm. Let us see why. Forearm muscle weakness is a probable sign of radial nerve injury caused by crutch pressure on the axillae, right? Crutch palsy is observable in axilla crutch users who rest their weight on the shoulder rest. The pressure on the brachial plexus can result in palsy to the radial and ulnar nerves. Extra padding on the shoulder rest can aid in preventing crutch palsy. That is part of reduction of risk potential. Reduction of risk potential, which is 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam, all right? Management of care or coordinated care, pharmacology, physiological adaptation, and reduction of risk potential make up more than half of the NCLEX exam based off of the categories, okay? So make sure you guys understand that. This is part of what? Crutches, canes, and walkers and ambulation, right? Circle back, find that information, and keep pushing, doing your questions. All right, D, you got it. You got it. Hey, of course, once again, ladies and gentlemen, I have some test taking tips to help you conquer the NCLEX, minus the fanny pack because, if you got a fanny pack, then whatever. It's a free download. You guys can check it out. It's over there at my website, thebootnurse.com/test, or you can find it in my link tree on my main page in my bio. All you got to do is go up here and then click the other portion here, and then you'll see right there where it'll say the link tree, so you guys can check that out. But yeah, go over there and get your A's. 42 pages of deliciousness that'll help you conquer the NCLEX, all right? Don't ever say I ain't never tried to give you nothing. You know what I mean? So here we go. It says, well, if you don't know, now you know. You know very well. All right, here we go. Question 11. Which of the following statements should the nurse teach the neutropenic client and his family to avoid? Okay, what are we thinking? Perform oral hygiene after every meal, using suppositories or enemas. Perform perineal hygiene after each bowel movement, or using a filter mask. What are we thinking? Shout out to all 70 of y'all. We are doing NCLEX questions. Make sure you guys like, share, and follow. Hey, we're on the road to 20,000 likes. 20,000 likes. All right, I need 20,000 likes by the time I get to question 15. I'm just saying. Don't be greedy out here. Give them to me. Give them to me. Everybody's sending me B. With love is telling me C. Okay. All right. Let us see. I'll give you 10 more seconds. Let's see. See what else somebody got going on. See what else we got going on. Everybody's telling me B. Ashley's telling me B. Okay. Emma also is telling me B. Diamond, I see you said B. All right. Well, let's see what the answer is. Here we go. Here's our answer in 3, 2, and the answer is B, using suppositories or enemas. All right. Neutropenic clients are at risk for infection, especially bacterial infections of the gastrointestinal and respiratory tract. An incorrectly administered enema can cause damage or can damage tissue in the rectum or colon and cause bowel perforation, and if the device is not sterile, an infection. All right, that is part of health promotions and maintenance. What's up, Queen? How are you? That is health promotions and maintenance. It's a lower section at 6 to 12% on the NCLEX, but still very, very much important because you don't know the caliber of how that question could be asked to you. It could be a hard question. It could be a very easy question. All right, so you got to recognize how these questions are being asked to you. Right, bleeding. Yep. Bleeding, infection, right? But the key word is neutropenic, right? So neutropenic, they're very susceptible to infection because they don't have an army to fight off anything the common cold, all right? So we want to try to eliminate any type of risk for infection, all right? So here we go. Here we go. Question number 12. Question number 12. A female client is experiencing a painful and rigid abdomen and is diagnosed with a perforated peptic ulcer. A surgery has been scheduled and a nasogastric tube is inserted. The nurse should place the client before surgery in what position? We're talking about Sims, supine, semi-Fowlers, or dorsal recumbent position. What are we thinking? Tweedledee is telling me C. I don't know if you guys are seeing all those Michael Jackson like memes that are going around. I couldn't help myself, so I'm sorry. Kiki is telling me C. Oh my goodness. Queen Mindy is telling me C. Emma, you don't got, I can't really do it for you. Bree is telling me C. All right, let's see. Let us see. I'll give you guys 10 more seconds. Prone? Okay. Sure. I don't know where you saw that answer at, but you know, whatever. Let's see. Stop it. All right, here we go. All right, here's our answer. Here's our answer in 3, 2, C. You changed? Oh, my Emma. Come on now. Let's see. The answer is C. I read it all. Okay. All right. So, and the answer indeed is C. Semi-Fowler's position will localize the spilled stomach content in the lower part of the abdominal cavity. Initiation of fluid resuscitation should start as soon as a diagnosis is made. Insertion of a nasogastric tube to decompress the stomach and a Foley catheter to monitor urine output are essential steps. That is part of physiological adaptation. Michael Jackson would be proud. He would. He would. All right, anyways. Physiological adaptation, 11 and 17% on the NCLEX, making it the third largest section on the NCLEX exam. If you did not understand that, make sure you circle back, get your content. That way you can apply that content to your questions and you retain the information with your rationales. All right, so shout out to all of y'all. Here we go. Question number 13. Which nursing intervention ensures adequate ventilating exchange after surgery? Oh, I'm sorry. Is it A, remove the airway only when the client is fully conscious, assess for hypoventilation by auscultating the lungs, position client laterally with the neck extended, or maintain humidified oxygen via a nasal cannula? What are we thinking? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. NCLEX questions. We're on the road to 20,000 likes. We are on the road to 20,000 likes. If I don't have 20,000 likes by the time I get to question 15, I guess that's where we're stopping for the day. I guess that's where we're stopping. So hope everybody's having a really good Wednesday out there. If you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here? Diamond, you got to give me one. You got to give me one, A or D, but you got to give me one. Make a decision and run with it. This is why we practice, right? Lala is telling me A. Yvette's telling me B. Hey, look, Nurse C is in the building, ladies and gentlemen. If anybody ever in their life has a problem with dosage calculations, if you're in nursing school or you're getting ready to prepare for NCLEX, Nurse C is who I call the queen of dosage calculations. And she will get you right. Look, I'm about to pin her comment, right? So if anybody ever needs help with dosage calculations, Nurse C will get you right. Hey, don't even pay attention to her emoji face. She know I'm talking about her. She is the queen of dosage calculations and she will get you right. All right. So y'all make sure y'all go over there, y'all follow her and y'all check her out and all the great, awesome stuff that she has going on. But the answer is C. Oh my God. Position client laterally with the neck extended. All right. Almost went See, you can't be going with the crowd now, all right? Positioning the client laterally with the neck extended does not obstruct the airway, so the drainage of secretion and oxygen and carbon dioxide exchange can occur. This position promotes oxygenation via maximum chest expansion and is implemented during events of respiratory distress. Do not let the client slide down. This causes the abdomen to compress the diaphragm, which can cause respiratory change. All right, this is physiological adaptation. Physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Oh my goodness, you two, ma'am, you know I got you. I thought it was D, ma'am, it was not. It was C. All right, it is. Y'all are too funny. All right. But hey, if you did not understand this, make sure you circle back, get the content, apply it to your questions, and keep it pushing. Read your rationales. RTFQ, RTFA, and RTFR. If you're a frequent flyer, let them know down in the chat what those mean. All right. Here we go. Question number 14. George has undergone thoracic surgery. Thoracic surgery has a chest tube connected to a water-sealed drainage system attached to suction. Presence of excessive bubbling is identified in the water seal chamber. The nurse should what? Strip the chest tube catheter, check this system for air leaks, recognize the system is functioning correctly, or decrease the amount of suction pressure. What are we thinking? Oh, everybody looks like they're telling me B. Oh my goodness, that's hilarious. Shout out to all 96 of y'all. We're doing NCLEX questions on the road to 20,000 likes. All of a sudden, I think I'm getting bronchitis. Bee. All right. I'm getting bronchitis, throat swelling up. I might be in respiratory distress because I don't know if I can talk anymore. You know what I'm saying? So Ashley is telling me D. Okay, Ash. All right, I'll give you guys another 10 seconds. Flossetta. Are we talking about Are you talking about the dream? She like, ooh, ooh, baby. All right, I'm done. No more of that. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. I don't know why that's so funny. Excessive bubbling indicates an air leak, which must be eliminated to permit lung expansion. Know the location of air leaks, right? So patient or system centered by clamping thoracic catheter just distal to exit from the chest. If bubbling stops when the catheter is clamped at the insertion site, leak at patient centered at insertion site or within the patient. Listen, if there's anywhere where you're supposed to have a seal, and if there is a leak, that is bad. That is bad. All right. So at the seal, anywhere at the seal, anywhere. If it's not supposed to be leaking. All right. That's how you know that something is wrong. That's part of reduction of risk potential. All right. 9 to 15% on the NCLEX, making it the 4th largest section on the NCLEX exam. I don't know why I had a hard time saying that, but y'all are picking up what I'm putting down. Air outside of the lung, no good. That's right. We don't want that positive pressure invading my negative space. All right. We don't want that positive pressure coming outside of the body to be pushing my lungs up against this heart. Right. We do not want that. All right. So it says, I looked for you last week on here. Were you on vacation? I was not. I was actually at a conference all last week and I had really bad signal. So I did not do TikTok live last week. All right. Here we go. Question number 5. Oh my goodness. All of a sudden, my voice came back, y'all. Here we go. Question 15. All right. A client has been diagnosed with hypertension, is being taught to restrict intake of sodium. The nurse would know that the teachings are effective if the client states what? So was it correct if the patient stated that I can eat celery sticks and carrots? Was it correct when he stated that I can eat boiled scallops? Was it correct when he said that I can eat shredded wheat cereal? Or was it correct when the patient said that I can eat spaghetti on rye bread? Pizza and fries? Eric, stop it. Stop it. Pizza and fries sounds good, though. I ain't gonna lie to you. No cap, as the kids say nowadays. So what are we thinking? I can't say A. Coca-Cola. Yum. Never eat shredded Wheaties. First of all, shredded Wheaties are full of fiber, so you know what that's going to do to you. Shout out to all 90 of y'all. Shout out to all 90 of y'all. We are rocking. We are doing NCLEX questions. We are doing NCLEX questions, both for RNs and PNs. Got it off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right, here we go. Let us see what the answer is, y'all. Let us see what the answer is in 3, 2. And the answer is C. I can eat shredded wheat cereal. It looks like it was C. All right, here we go. Wheat cereal has a low sodium content. It says, yes, I got it. Celery is full of soda. Look at that. C. What? Listen, all right, we're about to go through it. Sodium controls fluid balance in the body and maintains blood volume and blood pressure. Eating too much sodium may raise blood pressure and cause fluid retention, which could lead to swelling in the legs and feet or other health problems. Hey, wheat cereal is low in sodium. All right. How do we lower our blood pressure? Decrease the amount of sodium that we have, right? That's part of health promotion and maintenance, which is 6 to 12% on the NCLEX exam. I never would have thought that had sodium like that. Hey, listen, I'm just saying, you be so surprised. Celery is bad for you. Exactly. So stop eating it. Don't put peanut butter on it. It's still gross, people. Okay. Here we go. Ladies and gentlemen, once again, I got some free test taking tips over there. Who does not like free? Who doesn't like free? All right. Hey, go over there at thebootnurse.com, or you guys can check the link tree on my main page on my bio, and you guys can go in there and you guys can see that I have some free test taking tips for you. It's 42 pages. 42 cream cheese on it. Gross, nasty. But free test taking tips to conquer the NCLEX. I'm gonna tell you why. You want to know how to conquer the NCLEX? It begins with you. You need to find out where you have a deficit at, and you need to improve upon it. So if you failed the NCLEX like I have in the past, use that CPR. All right. Use that candidate performance report. See where you have below areas at. That's where you start. Mine was pharmacology. Stop playing games. Pharm is hard. I don't give a shit what nobody tells you. All right. Pharmacology is hard. So like I said, make sure you guys go over there and you guys get those questions. All right. Or get that download. All right. Here we go. Question number 16. Question number 16. A male client with a history of cirrhosis and alcoholism is admitted with severe dyspnea resulting from ascites. The nurse should be aware that ascites is most likely the result of increased what? Is it pressure in the portal vein? Is it production of serum albumin? Is it a secretion of bile salts? Or is it intestinal osmotic pressure? Listen. Nurse C, she does dosage calculation all the time. Nothing but pharmacology. All right. Nothing but. And pharmacology will never go away, ladies and gentlemen. It will never go away. So don't think just because you didn't do it in school a lot, maybe, and you didn't see it a lot, you will see it every day when you work a floor. All right. I do not want you to be complacent with your pharmacology. I don't want nobody ended up like Redonda Vaught. You know what I'm saying? We don't want that. I'm not saying that to, be bad towards her name. You know what I'm saying? But a lot of things happen. Give nothing but meds. That's what I'm saying. All right, here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A, pressure in the portal vein. Let's talk about it. Enlarged, cirrhotic liver impinges the portal system, causing increased hydrostatic pressure resulting in ascites. Portal pressure increases above a critical threshold and circulating nitric oxide levels increase, leading to vasodilation. As the state of vasodilation becomes worse, the plasma levels of vasoconstrictor sodium retentive hormones elevate, renal function declines, and ascitic fluids form, resulting in hepatic decompensation. All right. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at what? 11 to 17%. All right. 11 to 17%. If you don't know, now you know. All right. Remember, like I said, chronic, acute trauma, medical emergencies, that falls under physiological adaptation. All right, that falls under physiological adaptation. If you don't understand that, circle back, get the information, All right. And then keep it pushing by doing your questions and your rationales. All right. Got to keep it pushing. All right. Here we go. Question number 17. A newly admitted client diagnosed with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. What does the nurse assess first after the procedure? All right, is it vital signs, incision site, airway, or level of consciousness? What are we thinking? Who just screamed my name like that? RN Gabby. Gabby, what is the deal? Talk to me. Talk to me, Gabs. What's the deal? Emma is telling me C. As a matter of fact, a lot of y'all are telling me C, so that's cool. Claire is telling me C. Ashley's telling me C. What else we got? What else do we got? Zion's telling me A. Okay. I don't know if you remember me when I talked about stressing, but I passed my NCLEX. Yes, Lord. Gabby, you are number 4 or 5 to come in here today to tell me that you passed your NCLEX. Gabby, I remember you. All right. Listen, look at you. Look at you out here thriving just like I thought you would. Welcome. First of all of y'all need to tell Gabby congratulations right now. Stop playing games with me. All right. Stop playing games. As a matter of fact, Gabby, I'm about to make you famous. I'm just going to pin you right there. All right. Gabby, welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to all 85 people out here, what would it be? Once again, ma'am, congratulations to you. Welcome to nursing. But let us see what this answer is in 3, 2. And the answer is C. It is airway. All right. It is airway. Assessing for an open airway is the priority. Somebody said it, ABCs, right? The procedure involves the neck. The anesthesia may have affected the swallowing reflex, or the inflammation may have closed in on the airway, leading to ineffective air exchange. When the numbness wears off, the throat may feel scratchy for several days. After the test, the cough reflex will return in 1 to 2 hours. Then the client may eat and drink normally. That is part of management of care, ladies and gentlemen. Management of care, or if you're an LPN or LVN going for the exam, that's coordinated care, right? That is the largest section on the NCLEX exam at 15 to 21%. Some places will say 18 to 23, some will say 15 to 23, does not matter. It is still the largest section on the exam. All right. Priority, ladies and gentlemen. They're going to ask them to you in regular multiple choice questions, select all that apply, as well as in case studies. You need to know your prioritization questions. All right. Don't be coming back here and be like, Kevin, I got a lot of prioritization and I failed. And I'm like, well, damn, I told you. All right. So I'm just letting you know. All right. But congratulations to Gabby for doing her thing. Super proud of you. Here we go. Question number 18. A client has 15% blood loss. Which of the following nursing assessment findings indicates hypovolemic shock? All right, is the systolic blood pressure less than 90 millimeters of mercury? Pupils unequally dilated, respiratory rate of 4 breaths per minute, or is it a pulse rate less than 60 beats per minute? What are we thinking? Tweedledee is telling me D. Ashley's telling me A. Eric says congrats, A. Sparks is telling me D. Hey, shout out to all 83 of y'all. We are doing NCLEX questions. Make sure you guys like the stream, you guys share, and you guys follow. All right. You guys share and you guys follow. That is the trifecta that gets out to the For You page. Because I'm pretty sure a lot of y'all found me from the For You page. Listen to me run my mouth. All right. No, wait, it's A. I don't know, Tweedledee. Are you sure? Shit, my pulse is less than 6. Eric, you a marathon runner or what? Or you work out? Because you know that's one A. That's okay. That's a normal thing. You know what I'm saying? My resting heart rate's like at 58 or something like that. So, but here we go, y'all. Here we go. Here's our answer. Here is our answer. In 3, 2. And the answer, of course, is A. Remember what our normal blood pressure is, ladies and gentlemen. Remember what our normal blood pressure says. Yes, my resting is in the 50s. Yeah, so is mine, right? So that's normal for us because we work out. Now, if I was overweight and I was drinking and if I had heart disease or CHF, that's probably not a good thing, right? So, yeah, boy. Here we go. Typical signs and symptoms of hypovolemic shock indicate systolic blood pressure of less than 90 millimeters of mercury. The first changes in vital signs seen in hypovolemic shock include an increase in diastolic blood pressure with narrowed pulse pressure. As volume status continues to decrease, systolic blood pressure drops. As a result, Oxygen delivery to vital organs is unable to meet the oxygen demand. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. All right, make sure you, remember, we're talking about hypovolemic shock. That is a medical emergency. Medical emergencies fall under physiological adaptations. Okay, narrow pulse is the key. Indeed, is the key. All right, here we go. I'm trying not to play that out. But I can't help myself. Here we go. Question 19. Nurse Lucy is planning to give a preoperative teaching to a client who will be undergoing a rhinoplasty. Which of the following should be included? Is it A, results of the surgery will be immediately noticeable post-operatively? Normal saline nose drops will need to be administered preoperatively. After surgery, nasal packing will be placed 8 to 10 days. Or is it D, aspirin-containing medication should not be taken 14 days before surgery? What are we thinking? What are we thinking? What are we thinking? Shout out to all of y'all. Shout out to, who is that? Deanna is saying D. Okay. DD is saying D. Sorry. D for the risk of bleeding. Okay, Ashley, I see you. All right, y'all. We need 5 more seconds. 5 more seconds. Here we go. Hey, there we go. Here we go. And 3, 2, and indeed, the answer is D. Aspirin-containing medication should not be taken 14 days before surgery, right? Aspirin-containing medication should not be taken 14 days before surgery to decrease the risk of bleeding. Impaired coagulation may cause post-operative complications. Patients should be asked about a history of excessive bruising or bleeding, consumption of drugs, supplements, or vitamins that alter coagulation cascade, or history of thrombotic events in the past. Any drug, vitamins, or supplements that impair coagulation might have to be suspended preoperatively. That is reduction of risk potential, which is the 4th largest section on the NCLEX exam at 9 to 15%. Surgery. Oh, man, I'm smart. I got 3 in a row. Ma'am, come on now. All of y'all are smart. Hey, remember, it's contagious. Yeah, it is contagious. Hey, so remember, on NCLEX, you're not going to get everything right? You just need to get more than half right. And not only do you need to get more than half right, you have to get those analysis and application questions right. You could get 60% of the questions correct, but they could be memorization questions, which are not passing level questions. That's something that I want for you to realize. All right. There are different types of levels of questions, and you need to be at the analysis and application level. All right. The analysis and application level when it comes to answering NCLEX style questions. All right. Hey, I'm giving you these nuggets. Hey, pick up what I'm putting down. All right, here we go. Question 20. Paul is admitted to the hospital due to metabolic acidosis caused by diabetic ketoacidosis. The nurse prepares which of the following medications as an initial treatment for this problem? Is it regular insulin, potassium, sodium bicarbonate, or calcium gluconate? What are we thinking? What's the key word in this sentence? Insulin. Insulin. Oh my goodness. All right, we got C, we got A. Initial, Ashley, there you go, initial, right? So what are the first things that are given? You have to understand what the disease process of diabetic ketoacidosis looks like. And if you don't know, I'm telling you right now, you will get a question of some shape or form regarding diabetic, DKA, some type of diabetes. NCLEX loves to talk about the endocrine system. They love to talk about it because it is a very big thing and it's a very prominent thing that happens, okay? Kussmaul respirations, okay? All right, y'all. Let us see. I'll give you 10 more seconds. What else are we thinking? We got C, we got A, got C, we got A, and we got a B. Sherry, I saw you in here answering too. So this is a blood sugar higher than 500. Yeah. All right, y'all, let's see. Let's see what the answer is. In 3, 2, and the answer is A. It is regular insulin. It is regular insulin. All right, let's talk about it. Let us talk about it. Metabolic acidosis is anaerobic metabolism, all right, caused by the lack of the ability of the body to use circulating glucose. Administration of insulin corrects this problem. The discovery of insulin along with antibiotics has led to the drastic decrease of mortality with DKA down to 1%. Intravenous insulin by continuous infusion is the standard of care, right? Previous treatment protocols have recommended the administration of an initial bolus of 0.1 unit per kilogram, followed by the infusion of 0.1 unit per kilogram per hour, all right? Can DKA be lower than 500? It depends on the person. It does. It does depend on the person, Judith. People can be in DKA at 400 or 350. All right. So it all really just depends on the person, right? Yeah, boy. But that's part of physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX exam at what? 11 to 17%. All right. And of course, ladies and gentlemen, I have test taking tips that you guys can go over there and grab. 42 pages minus that melanated man right there with his fanny pack. Did I even have that thing closed? I think it's open. Anyways, I'm a dirtbag. I'm fixing myself. All right. But anyways, hey, go over there and get that thing for yourself. It's a free download. All right. At thebootnurse.com, or you guys can go over there and you can find it. You can go over there. You can find it in my link tree on my main page. Remember, the number one thing to conquering the NCLEX is you. It is you changing up your mindset if you failed, and you getting in to the mindset of NCLEX. All right, getting into the mindset. It says, "I love the fanny pack. That's awesome." Look, Julia, you know how I do. But ladies and gentlemen, that is a wrap. That is a wrap today. I got 5 of them fanny packs. That's what I'm talking about. That is a wrap today on the NCLEX exam. It says, have a good one, 9 to 10 shift tonight, one more tomorrow, and we done being a student. I know that's right, Eric. Go ahead, do your thing. No, it is indeed. It is a wrap. It is a wrap for the questions. But I will do an Ask Me Anything after this, all right? But I appreciate everybody hanging out and participating. I love the fact, hey, listen, I love the likes. I love the gifts. While they are not required, they are very much appreciated. I didn't ban anybody, but if I ban you, that makes me happy because I'm petty. Over 9,000. Okay. So if you ever come over here and act a fool and I ban you, or one of my mods banned you, just know that you're banned forever and I don't want you around me. So once again, I don't gatekeep. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. I do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time. I have an NCLEX course. You guys can go over there and check that out. It's $97. That link is in my bio. I have 80 questions in there with 2 different NCLEX reviews. One breaking down the client needs sections on the NCLEX like I did right here, as well as another one with the new generation NCLEX review. And I go over 100 questions. Hey, once you get it, you get it for a lifetime. Once you get that review, you get it for a lifetime. You get all the updates that I throw in there. All right. And that's at thebootnurse.com/special, which is also laid up in my link tree. If you want that free download coaching, I got an ebook. Or if you want one-on-one coaching for NCLEX, you can check my link tree as well. I'm doing a live 3-day NCLEX review May 5th or May 3rd to May 5th. You can check my link tree to register for that as well. But hey, are you going to see me Friday? Emma, hey, I'll see you on Friday. Right? So, hey, what question? Hey, first of all, what's up, y'all? My hair is it's looking kind of a mess right now. You know what I'm saying? But hey, how y'all doing? So if you guys are new here, my name is Kevin. I go by the Boot Nurse on all those social media platforms, right? I've been a nurse for almost 4 years. I worked ICU, OR, and PACU, as well as in the Navy for 16 years. Last 9 of my 16 years, I was a master instructor. I taught a whole bunch of courses. I became a nurse while I was in the Navy. And then I got out of the Navy to come out here and do my thing. So what questions do you guys have? It says, thank you, everyone. Have a great night and keep on going. You got this. You dreading it? What am I dreading? What am I dreading, Lala? It says, first time here, and I definitely will be here again. I've been looking for this type of review. Emma, I got you. Ma'am, I got you. So I'm happy that you were here. Make sure you follow. Turn that notification button on. As well as, tell your friends about me. Oh, am I dreading? No. I don't have the head for dreads. I couldn't. And dreads, they be getting too hot. It's not really my thing. I live in Texas. It gets too hot here. I don't even know how I don't know how dreadheads walk around Jamaica when it's hot. Lord have mercy. So what's up, everybody? We got 44 people in here. What questions do you guys have about nursing, about NCLEX? Hey, a lot of y'all are taking your exit exams. A lot of y'all are trying to get into school. So what questions do you guys have? I'm gonna hang out for a couple of minutes and essentially see what questions do you guys have? Oh, look at that. My other mom is in here, SSH Mentoring. My other mom, Sarah. I just want to let y'all know that she is a wonderful person and one of my mentors and will literally be in my life forever. But if anybody ever needs and wants to understand how to start a business as well as how to scale your business to something that is extremely beyond you, y'all go check her out as SSH Mentoring, and she has some wonderful stories. Some wonderful stories. All right, y'all go over there and y'all check her out. What's your best general test taking tip? One of my test taking tips is I like to say know thy enemy. So I know exactly what the test center is going to look like, right? So I tell people to do is to recreate the testing center. So that means if you're blessed enough to have a space, turn that space into the testing center. No snacks, no food, no phone, no nothing. It's just you, computer. That's it. And that's how you do every single one of your quizzes or your computer adaptive test or whatever you're using. That's probably one of the biggest tips that I would give you is to recreate the testing center. If you put yourself in the mindset of what the testing center looks like, then hey, you're starting it off strong. Award-winning author. Hey, that's me. By the way, y'all, I have a book that's coming out that you can pre-order that is in my link tree. It's going to be available June 5th, right? And ironically, June 5th is my 4-year anniversary of becoming a nurse. The book is called Conquer It. It's called Conquer It, The Journey to Passing NCLEX. Why? Because I failed NCLEX 3 times, and then I passed it on the 4th. I want everybody to know that it's okay for you to fail, but it is not okay for you to quit. All right. You learn a lot from failure. That's how you become a better person, not just as a nurse, but in life. So you guys can go over there and check it out, and you guys can pre-order it. All right. Emma says, I'm having trouble with psych. So with psych, Emma, here's what I'll tell you. 2 things. Safety of the patient, safety for everybody, patient, other patients, and you. And it's all about good therapeutic communication skills, right? Such as anything that can keep the patient talking. All right. That's what you want with regards to psych. Once you understand those principles, which are very, very small amount, you're going to knock psych you're going to knock it out. The book is amazing. I'm glad that you love it, Sarah. I'm glad that you love it. I got a 70.4 on my ATI and need a 74. I will be taking my second attempt in 3 weeks. Lala, you got it. You got it. I don't know anything personal about ATI. If you go follow my other homie, my A1 since day one, Nurse Glamber, aka Nurse Amber. She is another NCLEX strategist. She used ATI and she hates it, and I don't blame her because I used HESI and I also hated it. So I don't necessarily know exactly how to navigate through that, except for studying the big sections like management of care, farm, and physiological adaptation. Yes, Emma, I did twice. You did what twice, Beauty? Oh, you took the exam twice? Hey, that's okay. How about Mother Baby? Mother Baby is all about understanding that when in doubt, check the fetal heart rate. That's a big one. When in doubt, check the fetal heart rate. I just need to get through the rest of the class. If I fail, I'm out of the program. So, Ashley, I'm going to ask you, what's the worst thing that can happen to you if you were to fail out of the program? I love Mother Baby. I'm having a problem with pharmacology too. Same. So the thing about pharmacology is knowing about their family name and their suffixes. So if I start talking about cardiac meds, I know that I do the umbrella effect. So I know that cardiac meds contain ARBs, ACE inhibitors, beta blockers, calcium channel blockers, DIG, diuretics, anticoags, and platelets. And then I would look at the last portion. So I know that dipines plus verapamil and cardiazem or diltiazem are calcium channel blockers, right? And I know that's these meds are inotropic or chronotropic. These increase cardiac output and decrease preload, so on and so forth. So that's how you have to navigate them. Inside of my course, my 7-day NCLEX course, which is linked in my bio, I have 18 videos talking about the cardiovascular or talking about pharm from all the important medications that you need to know. All right, you should check that out. That's linked in my bio as well. It says good mother and fetal assessment is important. Absolutely. Letting myself and my family down. Ashley, let me tell you something. On your degree, it's not going to say your family. It's going to say your first name and your last name. That's what it's going to say. On your degree, on your license, it's going to say your first name and your last name. It's not going to have your family on there. Your family is a good support system, but your family is not the one who is walking this line of becoming a nurse, unless they've already been a nurse. And at that point, they should be a little bit more supportive to understand what is truly going on. All right. Paying student loans with no degree. So here's the thing. I ask you, how bad do you want to be a nurse? Right? How bad are you willing to take your dream and turn it into a reality? So this is where I say you have to find the deficit of where you are and improve upon it. All right. And that takes work. It's not easy. It's not meant to be easy, because if it was easy, everybody would do it. Right. I think you have 3 times for ATI. Then you're in a 3-month class and then you take it again. I think so. I thought you said depends, LOL, instead of depends. I said not depends, depends. Say that, Kevin. Hey, listen, I'm letting you know that right now. I got a degree right there. And it says only my name. It don't say nobody else's, right? The license, I printed it out. It's right behind the degree. It says my name. It don't say nobody else's. So this is where I tell you to get out of your own way. Get off your beach. You are the only person that will impede you from not doing well. You are the only person that will impede you from not doing well. All right. So if you want to do well, find out where you're not doing well at and improve upon those areas. OK. What to do after seeing a med aid or a head for LPN and RN school? I don't know, Christine. I don't know your life. So what do you want to do? Do you want to go the LPN route, or do you want to go the RN route? You can be and get in nursing if you got to the LPN route faster. It is a little cheaper, right, than going the RN route, because the RN route you can either get a 2-year degree or a 4-year degree. But it all just depends on financially how you can take care of that. And at the end of the day, what do you want? It ain't about what Kevin wants. It ain't about what I want. What I want is for everybody to do well and pass, but that doesn't happen. That's not the reality, right? But you really have to dig deep down and figure out what you want to do. My school lets you fail one course with a do-over and then kicks you out and can't reapply for 5 years. Ashley, there are so many damn nursing schools that are around here. It is unreal. It is unreal. I have literally coached students who failed out of one school, went to another school, passed and graduated, and got a license, So it all, like I said, it all just depends on you. It's great to study the systems. Yeah, it's great to study the systems. Study the systems based off of the ones that you don't know. That's what I'm thinking. LPN, then go LPN. Go do that. It says, I did a 4-year degree for RN, then went back to school to get my phlebotomist license. Why would you go RN to go be a phlebotomist when you can do phlebotomy as an RN? I'm in a community college ADN program in North Carolina. Shout out to you. Last class, okay, and then do over, okay. Ashley, yeah, even in other states, there's so much. Exactly. There's a lot that's out here. Let them know, Brooklyn. Let them know. But shout out to y'all. What other questions do you guys have? Hey, if you guys are just now joining, we just got finished doing NCLEX questions. I got those questions off nurseslabs.com. I know my hair is looking kind of like frizzy or whatever. Your boy needs a haircut because it's looking kind of rough out here. But yeah, what questions do you guys have? Like I said, we did NCLEX questions. I do them every Monday, Wednesday, and Friday at 5:30. Strength and Grace. I just finished my first trimester. Do you recommend that I get the NCLEX? Do you recommend I get the NCLEX 7-day now? So you can, if you get it now, you have it forever. You have it for a lifetime. I was running a trial not too long ago, but now that trial is now over. So once you get it, you have it forever, and you get all the updates. So you can get it now, and you be totally okay. It said, I just finished you mean first semester? I said trimester. It says, I do have a YouTube channel. If you go to the link in my bio and you'll see the YouTube tab, it'll take you straight to my YouTube channel. I need help studying for exams in an accelerated BSN program. Crystal. So I don't help, Julia. Appreciate the heart. Thank you so much. And I know Sarah gave me some stuff. Hey, Sarah, if you're still here, I love you. Thank you for all the gifts. What was I going to say? I don't personally coach or tutor for classes, like in nursing school, I specifically focus on NCLEX. You're starting in pharmacology. Okay. Hey, so I have like 18 videos in pharmacology, and I have a whole bunch of others. I have like 40 or 50 pieces of content that I'm going to be recording over the next couple of weeks that are going to be going up in there. So like I said, once you get it now, it's yours. For everyone looking for an RN program, coming from California, where nursing programs are a lottery. Yeah, that's true. And they charge you like an arm and a leg, like well over like $130,000 to go there for the whole program, which is absolutely insane. No, they call it trimester because it's an accelerated program. Oh, great. That sounds dumb. I don't know why they do that, but okay, that makes sense. I decided to look at other states, and the programs are much nicer. Yeah. So that's another thing. How willing are you to, to relocate to get this license? It was rough, but I passed the NCLEX. That's what I'm talking about. That's what I'm talking about. Some people will come. I've had people come up to me or come up to my other students and say, I don't understand how you failed NCLEX. It was easy. First of all, bro, nobody asked you about how it was. You have no idea how other people are living their life trying to study for this exam. This exam is difficult. It's difficult. It requires you to study. You have these people that are anomalies that may not study, and that's okay, right? But that's not like that for everybody. If the exam was so easy, last year we wouldn't have a 79% pass rate. Or sorry, the year before we wouldn't have had a 79% pass rate. Last year we wouldn't have had like an 88% pass rate. If the test was so easy, we would have like, 95, 99 or 100% pass rate. But, you have those people that don't pass. So everybody learns different. Exactly, Anna. Exactly. I studied a full month and then took the exam. It's hard. Exactly. I studied when I finally passed the exam. I studied for 54 days with breaks in between there, and then I passed. I had to kind of figure that out. You are awesome with your honesty, reality, and encouraging words. Thank you. Geraldine, hello. If you guys don't know Geraldine, she is also a frequent flyer who has been to my lives. Geraldine has actually been to my live NCLEX review that I did about 2 weekends ago, and she thoroughly enjoyed that. So, hey, if you are about to graduate and you want to do a 3-day NCLEX review with me, where we go over, everything that you need to know based off of the 8 client needs sections for the NCLEX, you guys can check that link out in my bio. It's in my link tree, and it's labeled 3-day live NCLEX review. All right. Should you read the fine line, but that fine had a fine line? What? What do we mean? I will send my students to you. I love it. Send them to me. Send them to me. Give me all the students. Give them to me. Like I said, I've been an instructor since 2015, and I've been teaching ever since, and I found my purpose. I love teaching. I love teaching as many people as I can based off of the knowledge that I know. So, but shout out to all 33 of y'all and everybody that's jumping in. We just finished doing NCLEX questions. All right, we just finished doing NCLEX questions. So if you guys want to be a part of that, make sure you guys follow, and you guys turn that notification button on. All right, so you guys know when I go live. I go live every Monday, Wednesday, Friday at 5:30 Central Standard Time, because that's the only time that matters. Just saying. It says, missed the live NCLEX, love the info content. Absolutely. Absolutely. So what other questions do you guys have about NCLEX, about nursing, about, your first year as a nurse, your first 2 years as a nurse, imposter syndrome? Trust me, everything that you are experiencing, I have experienced, and everything that you're about to experience, I have experienced. So what questions do you guys have with regards to NCLEX and nursing and all that good jazz? What is imposter syndrome? So imposter syndrome is that feeling of not belonging. So you go through nursing school, right? And you want to be a nurse, and now it's finally your time to work as a nurse. But once all the work starts hitting you, you say to yourself, I don't belong here. You feel like an imposter. You feel like you don't belong in the field, even though you went through the same type of nursing school, or you went through nursing school like everybody else. Okay, thought that, but wasn't sure. No, fine, for sure. I got you. I want to be an LPN, but first I have to pass my GED. Go, hey, you got steps. You got steps on a list. Knock it out. Get that GED and then go to school and go get that LPN. All right. Hey, just because you got a GED, your GED doesn't define you, right? And guess what? Nobody will ever ask you if you got your GED. They won't, right? But yeah, that's what imposter syndrome is, Brooklyn, right? A sense of not belonging, even though you put in the work to be there. But it takes time, it takes growth, it takes, failures and mistakes in order for you to get better after that. And usually imposter syndrome can last anywhere from between 6 months to a year. So I'm trying to get past boards. So there's a big difference between getting past boards and trying. You're either going to do it or you're not. There is no try. So that's where I recommend finding out those areas that you don't do well in, and you started studying in those areas first. So pharmacology is one. Then I would recommend studying there first. You're tired of studying? Trust me. I understand that you're tired of studying. I understand that. But you being tired of studying and then not studying won't get you that license. That's the reality. You know that. I don't got to tell you that, but you know that. Kevin, have you noticed that some nursing schools are doing away with the T's? I did not notice that. I did not notice that at all. Just finished my prereqs. Now it's time to take the HESI, like the HESI A2, Sierra, the HESI A2. All right. Hey, there's one young lady that does HESI A2 and T's reviews or practices, the nurse Sam. Yeah, you can follow her. She does T's, or you can get that Mometric book. It's like the yellow Mometric book for HESI. It's golden. It's golden. All right. What other question? I love how you are reading everyone's comments. Yeah, I'm sitting here. I literally said y'all can ask me anything. If I at one point in time I had like 300 people in here and I was trying to, like a typewriter. Wait, am I showing my age about a typewriter? But trying to follow everybody. So I try to answer everybody's questions as much as possible. Very nervous, but yes, I have seen that book on Amazon. Get that book. I would recommend getting that book for sure. And it's okay for you to be nervous. Hey, you want to know something else? The first time I took the HESI A2, I failed it. Look, I'm just a bundle of failure here. So I took it the second time, blew it out of the water, got into nursing school. Nobody ever fucking asked me, oh, you failed the HESI A2? Stupid. Like, nobody does that. I need that on a shirt. What you need on a shirt? The new NCLEX looks so hard. So anything can be hard if you don't prepare for it, right? So with the NCLEX, there's nothing new about it. The only thing that is different is how the content is delivered to you. They still have multiple choice. They still have select all that apply. They still have fill in the blank. They still have like the matrix charts. Like, they still have all that, right? But now it's delivered to you in a case study where they give you more information. And that's actually something that we talk about inside of my course, the 7-Day NCLEX course, which is linked in my bio, right? They give you all the information in the case study, and your job is to analyze the cues, recognize the cues, and implement based off of the information that is given to you. So if we start talking about somebody who has a low blood pressure, like 90/60 and a high heart rate, I'm thinking maybe this person is hypovolemic, right? Maybe. So that's how you recognize those cues. And that's how you're able to make a safe clinical judgment. You have to use your critical thinking in order to make a safe clinical judgment. That is exactly what the NCLEX test plan says. And that's what you have to do. And if that is not something that you do yet, you need to practice on that. All right. What reading material or apps do you recommend for NCLEX RN? So is it me IT? So I recommend my course, which is the 7-Day NCLEX course, which is linked in my bio. Right now you can get it for $97 and you have it for a lifetime. That means you get all the updates. That means you get all the updates. You get all the updates right now. So I have 2 NCLEX reviews that are in there. One's the new generation NCLEX review, and another is my 7-Day NCLEX review, where I go through each section of the NCLEX client needs, from management of care all the way to basic care and comfort. All right. And that's what I would recommend for you. Been a nurse a week now. I wrote my RN. I wrote RN by my name. So worth it. Even if it may not seem like it. Promise. I love it. I love that, Sherry. I love that for you. Okay. Thank you. We'll try and get one. Absolutely. All right. Sherry, I don't know if I posted it yet, but I screenshotted when you told me you passed the NCLEX, and I'm going to post it so that way people can see it. And I'm going to start posting everybody's wins on my website. I'm going to create a testimonial page because I want everybody to see all of the greatness that all of y'all are accomplishing. I'm from Texas. I say y'all. I'm not really a big fan of Beyonce's country album, but it's only because I'm not a country guy, but whatever. But I love Beyonce. Right? I take my NCLEX tomorrow. Nicole, can I call you Nicole? Can I call you Nikki? And it's all because of Nikki. Why are you here, Nicole? Why are you here? Talk to me. Talk to me, Nicole. Are you nervous? Is that what we're doing? Is that what you want me to talk you down a little bit? I got you. If that's what you want. You let me know. Yeah? Okay. It's okay for you to be nervous. It's normal. This is for all of y'all. It's okay for you to be nervous. All right? But I want you to think about how you studied, and I want you to think about how you prepared. All right? You put in the work. All right? I'm speaking these things into existence like you will pass NCLEX. That's what you need to say to yourself. Not only do you say it to yourself, you have to believe it. I can't believe it more than you, and I can't want it more than you. Why? Because I have my license. Right? Speak it into existence. You prepared for this. You got this. All right. Man, I've been hanging out with Amber way too much. She's really made me like nice and like fuzzy wuzzy. And I'm not with that. You know what I'm saying? I'm about that aggression. I'm about putting in that fucking work and about getting this shit done. But, you know, Nicole, you got this. That's like real passive aggressive, right? But seriously, you got this. It's okay for you to be nervous. It's all a part of the process. All right. Say positive affirmations to yourself. All right. Positive affirmations. I've been speaking it out loud and manifesting it. I feel like manifest is like one of those overused words like toxic, but I got you. I got you. You speak it into existence and it shall be so. You speak it out there to the universe, it's going to give it back to you. All right. And so when you pass your NCLEX, because I truly believe that you will, you're going to come back on either Friday or Monday or whenever I do this. And you're going to come back and you're going to tell us that you rocked that NCLEX or you conquered your NCLEX. All right. And even if you don't, come find me and let me know. You will? Hey, that's what I like to see, and that's what I like to hear. Shout out to all 25 of y'all out here. We did NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. And now I'm essentially just doing an Ask Me Anything. A little bit about me. I've been an RN, BSN, if that really matters to you, for almost 4 years. And I was in the Navy for 16 years. Hence why, I have this. And then if I step over to the side, you see that I got this thing right here. And then my damn Dixie cup where, Cracker Jack hat, right? So, and I failed my NCLEX 3 times. And I'm here to let y'all know that that's okay. That's okay, because you guess who never asked me? My patience and my job. Because it doesn't matter. It doesn't matter. All right? What matters is that you don't quit. What matters is that you find where you weren't doing well within that failure and you keep it pushing. Dungarees. So I have a pair, but they're not in here. They're like in my sea bag somewhere, but I got a pair of dungarees. I do, the light blues and the khaki blue bottoms. I don't got the boots anymore because, them things was nasty, right? That was back in the day. All right. Oh shit. Kanye West is in here. What up, Kanye? Oh, Kanye's gone. Never mind. But shout out to y'all. Hey, so what other question do you guys have before I get off here? What other question do you guys have before I get off of here? Somebody got Jesus music on in the living room. All right. All right. All right, cool. Well, since you guys don't have any other questions for me, oh, here we go. It says, what about the NCLEX was hard for you? Honestly, it was my lack of content understanding. It was my inability to apply NCLEX style questions. And to be completely honest, it was all of the negativity that my goddamn professors, a few of them in my school, that were just saying that, oh, if you fail the NCLEX, you're not going to be able to take this test again. They were doing a lot of these negative, these negative affirmations telling you that, you should find another profession, yada, yada, yada. And I'm like, well, or if you fail, then, you're a terrible person. They used to say some wild shit to us. So, It was accumulation of all that. And then I had to really realize that everything that they said was a fucking lie. And two, I am my own worst enemy, and I need to get out of my way, and I need to figure out why I am not doing so well. So those were the things that made it hard for me. Once I got over those obstacles, studying for the NCLEX became a lot more tolerable, and then it became like involuntary, like breathing. Like I had a schedule and everything, and it worked out really well for me. Some teachers shouldn't be. You're right. Some teachers really should not be teaching. They really shouldn't. Where do I find your pharmacology videos, and med videos? So my pharmacology videos are inside of my course. So if you're looking for the course, go to click on my nice little self up here with my fanny pack, and then you'll see my face again. Pop it right there, and then you'll see my main page. It'll take you to my link tree. In my link tree, you will see where it says 7-day NCLEX course. And in the 7-day NCLEX course, that's where I have all of my pharmacology videos. And on my YouTube channel, it has my replays of all of my TikTok lives. I'm an LPN. I am in an LPN to RN bridge, and my daughter is in the LPN program. We graduate in December. That's mother-daughter stuff? Yo, love it. Love to see it. Love to see it. I plan to get the review for us. Love it. Love it. Love it. Love it. August, get it. Get it. Because I'm going to be adding some more. Like you say, you guys graduate in December. By the time you guys graduate in December, there'll be well over 100 videos in there. I have like a backlog of like 40 or 50 videos to record, right? Full of content for y'all. That way y'all can get this knowledge. All right. So, all right, y'all. We're like right around 7 o'clock on the dot. If you guys are just now joining, I do NCLEX questions, right? Every Monday, Wednesday, Friday at 5:30. If you guys want to check out where to get those free questions at that nurseslabs.com, they're free sets of questions. So like I said, go over there and check those out for yourself. Unshameless plug, because I'm never ashamed about what I have going on. Check out my link tree inside of my bio. There's a free download over there. I have an ebook that you can get, over 700 pages. I have an NCLEX review that you can get. It's $97 that you can get for a lifetime. Also, I have an actual book that I'm going to be an award-winning author. And it talks about my journey of conquering the NCLEX, because I want everyone else to know that it's okay. It's okay for you to fail. It's not okay for you to quit. All right. So make sure you guys go over there and check that out. You guys can pre-order that. And then, of course, if you are one of those individuals who just don't know where to start, don't know where to begin, have horrible accountability, you need help with a schedule, you need a tracker to, so we can make precision changes. I also do coaching and mentoring, and that link is also in my link tree if you're one of those individuals who require some one-on-one attention. All right. So not ashamed about any of that, because I'm out here for y'all. All right. It says going into psych, even though people are telling me I'm wasting my time. Jeremiah, it doesn't matter. Who cares? Who cares what other people got going on? They ain't doing what you're doing. They're not doing what you're doing. So they're going to tell you that you're wasting your time, but who the fuck cares? Are they in Jeremiah's life? Are they in Jeremiah's shoes? I think not. So I say, go do what you want, good sir. Go do what you want. Thank you for your service, both in the military and healthcare. I appreciate your support. I appreciate it. I'm not a book/test smart, but I always got my patients sending in Daisy nominations. That's more important to me, caring for patients. Absolutely. Caring for your patients is number one. No, I'm sorry. Caring for your patients is important, but caring about you is number one. Because if you don't take care of yourself, you can't take care of them properly. All right. So remember, self-care and then caring for others. That's for everybody. All right. And until you learn that, not you, blessing, but just for other individuals, right? But for other individuals, people need to really learn, and they need to understand that. All right. 100% agree with you. Jeremiah, go do your thing. Don't stop listening to other people. All right. You'll hear people listen. People will tell you don't go to med-surg. If you want to go to fucking med-surg, go do you. All right. Go do you. Just saying. A lot of people will tell you to not go work for insurance companies. Shit. If I could sit at home and be in front of a computer all day and I can work get out of my face. Get out of my face. All right. But anyways, like I said, I appreciate everybody stopping by. I appreciate everybody being a part of the live. We need good psych nurses. I don't like psych, so please do it. Listen, I can't do psych because, number one, I find things too entertaining. Number two, I'm always ready to fight. Because being in a cell block, nah. When I saw like this dude jump over the nurse's station, and then one of the like behavioral health techs like tackled this dude. Whoo! I was in nursing school when that happened. Boy, let me tell you, I got some stories. We throwing hands to that. Look, listen. I had to think to myself in a split second, do I want to go to jail? Do I want to get kicked out of nursing school? Or do I let this dude just kind of swing on me? And at that point, I couldn't even make another decision because he already got tackled. You want a story time? All right, so long story short, I got put in the adolescent boys like from 13 to 17. This 15-year-old got mad because he wasn't allowed to leave the day room or whatever because he had assaulted another kid. So when they told him no, he started flipping out. My man grabbed the phone, ripped it out the wall, started tearing up the day room. Like, and it was like flipping the fuck out. It was actually, in my mind, it's not funny, but it was fucking hilarious to me. So then they call it code green. All these people start funneling their way in there, right? One little behavioral health tech was a blonde. She came in there like within 10 seconds, was fucking throwing her hair back. It's like she I swear it's like she had brass knuckles on, but I'm pretty sure she didn't. But they end up funneling him like into a corner. Then he bolts like down the wall. And then when he bolts down the wall, he jumped. My man fucking might as well have like Olympic hurdled over the fucking nurse's station. And then here I am standing right there. And I'm just like, I have my hands right here and I'm looking at him and I don't move. At this point, split decision. Do I punch him in the face? Do I let him hit me? Like what? What do I do? But then he kind of just like jukes me. And then by that time, there's already like 5 people around. And he tries to like push one of them away. And then he grabs the fire extinguisher that's mounted to the wall and rips that shit off. I mean, rips it right off the fucking wall. And at that point, I'm just like, hey, God, me again. Because I thought that shit was going to hit me. And the next thing you know, they pushed him into like this seclusion room. And then they fucking hit him up. My man was knocked out after that. So that's my story time. Hey, if you like that, if you like these story times, y'all let me know. I work in a jail and I see that all the time. Listen, okay? Hey, I give y'all credit for y'all that work in corrections and that work in psych. Because me, Kevin, no. We good. So, but anyways, like I said, I hope everybody has a really good rest of their evening. If you're taking your NCLEX today or tomorrow, best of luck to you. Even though you don't need it, I know that you prepared for it. And I want you to come back when we do live again. And I want you to tell me how you did, whether you passed or you failed. All right? Because we don't judge people around here. We have to uplift this community because we have to take care of one another. No one else is an engineer going to come over here and be like, oh, it's okay, nursing, whoever, you'll do better. Like, we have to take care of our own, all right? We have to make ourselves better in all aspects. So, like I said, with that being said, I appreciate everybody stopping by the live. I appreciate everybody giving me the likes and everything. Make sure you guys go check out my link tree and everything I got available because I'm doing a live NCLEX review from the 3rd to the 5th of May. I want you guys to come be a part of that, all right? And until then, I will see you guys on Friday.